Good morning, everyone. Today I am discussing about erythrocytosis. So, erythrocytosis, if I talk about uh, erythrocytosis. So, if we talk about erythrocytosis, it means there is increase in erythro means RBC. There is increase in RBC cell mass, red blood cells. So, uh, these cells they are present in billion number. So we generally this is very impractical way to count these cells. So diagnosis of erythrocytosis is generally made on PCV or HCT level, packed cell volume or hematocrit. So if we talk about certain breeds like greyhounds or other sight hounds, they generally have higher PCV or higher RBC cell number. So it is generally seen that these breeds have higher PCV than other breeds. So around 70% PCV is considered normal in greyhounds and other sight hounds. So if we talk about so what is the function of red blood cells? They carry, so it has hemoglobin, so it carries oxygen to the tissues. So these cells carries oxygen to the tissues. So whenever there is problem with the oxygenation, right, like some dogs they live in high altitude, so they have problem, so their body compensate and they will have higher PCV, so or higher RBC count. So means high altitude has role in increase in PCV. So it is considered, it is physiological increase, it is seen, right? So if I talk about classification of erythrocytosis, classification, if we talk about depending on pathogenesis. So there are two types of erythrocytosis: relative, based on pathogenesis, relative and absolute. Relative means it is not actual erythrocytosis. It appears, but it is not actual, right? For example, in dehydration, what happens in dehydration? There is increase in PCV, not a RBC count. So you can't say it is a actual erythrocytosis. You just simply say it is a relative erythrocytosis. So it is a relative erythrocytosis. So in dehydration or relative erythrocytosis, you see increase in PCV and increase in total protein. So, but one exception is there, like hemorrhagic gastroenteritis. In hemorrhagic, like in parvovirus infection, in hemorrhagic gastroenteritis, you just simply see the increase in PCV, but you find normal total protein level, but it has relative erythrocytosis. This is the one exception. You just see that. But in absolute erythrocytosis, it is actual increase in RBC count. So there are two types of absolute erythrocytosis. It could be primary, it could be secondary. In primary erythrocytosis, it is generally seen when there is bone marrow proliferation, or we can call it as myeloproliferative. Myelo means bone marrow. Myeloproliferative disease. So what happens is, why I should say primary means RBC, any blood cell production occurs in the bone marrow. So why I say it is a primary means root where RBC cell production is there, right? So secondary erythrocytosis means when there is increase in erythropoietin hormone. Erythropoietin hormone is generally produced by kidneys. Although some tumors, they produce erythropoietin. When kidney produce excess level of erythropoietin, what is the condition when kidney produce excess erythropoietin? Whenever there is tissue hypoxia. So when it is produced by kidney, so it is called as orthotopic erythrocytosis. When it is produced by some other tumor cells or tumors, it is called as heterotopic erythrocytosis. So this was the definition and classification of erythrocytosis. So if we talk about clinical signs of erythrocytosis, so clinical signs of erythrocytosis is what you see. There is increased viscosity of blood. So if there are high erythrocytes or red blood cells, so there is increased viscosity of blood. So blood becomes thicker, right? So what you see clinically, there is chances that proximal sneezing. Why it happens? Because there is increased blood viscosity in the nasal mucosa. There is sneezing and bright red mucous membrane. Bright red